actually have one of my staff members filtering through a lot of the applications, and she's a little strict. I just really enjoy giving patients something new. And me and that patient had a full heated argument over what was best for them.
This is Optometrists Building Empires, and I'm your host, Ankit Patel. Each week, we'll explore the journey of practice ownership and leadership in optometry. Join us for insights and strategies from the top minds in our field. This show is sponsored by My Business Care Team. My Business Care Team helps your office increase revenues, reduce costs, and reduce staffing headaches. Let's build your empire together. Today's guest is someone I'm excited to speak with. He's committed to redefining modern optometry by emphasizing individual treatment and leveraging cutting-edge technology. He led the evolution of his multi-doctor practice by expanding services, integrating advanced diagnostic technology, and cultivating a team that shares his vision for exceptional care. His clinical expertise spans preventative and primary eye care, ocular disease management, and emergency treatment, with a specialized focus in dry eye, myopia management, and vision care related to migraine and concussions. He's optometrist and owner of Peaksight Family Eyecare. Please welcome Dr. Darion Horner. Darion, welcome.
Thanks for having me.
Yeah, I'm excited to talk to you. So what was the most important thing that helped you grow your empire?
I'd say, as far as fueling, quote, the empire, I'd say it has to do with just seeing gaps in care and trying to set a standard of care that I'm happy with myself and that actually engages patients besides just writing scripts and for glasses.
So now tell me a little bit more about how that looks different at your practice than, let's say, a box store or another private practice.
So I would say we lean heavy on our technology and heavy on our team. We, focus primarily on medical-based optometry, and how that looks is comprehensive exam. Obviously, we're going to still treat their vision, make recommendations, and really come through as glasses and vision specialists. But we treat it primarily as a discovery exam for how we can, treat and educate patients beyond just what they expect with vision correction.
So if I'm coming in and prior to my industry experience, what I would do is I would come in and say like, okay, I'm going to come see the optometrist. I'm going to have to probably update my prescription, get some new glasses, and that's it, right? Like, I'm not here for a medical exam. I'm not here to see a doctor. I'm just here to see my optometrist. That's how I thought about it. Is that what you're referring to? You go beyond that for patients?
Yeah, we really try to actually, focus primarily on education of, what we are and what we can offer as a profession. There's a ton of patients that have no idea that we can even do red eyes and urgent cares and, just get bad care somewhere else. And so we really try to actually educate what our services are, even on those, routine preventative exams.
So I'm curious, how do you do that? Because it's, I imagine like you're saying like, which one's better, one or two? And oh, by the way, we treat red eye, right? How do you work that into the conversation?
Well, sometimes it can just jump in like that. Sometimes, it's having conversations with your patients. They might mention something that, happened to, their friend or the family member or something that's going through. And it's like, oh, by the way, if that ever happens, you can come to us or you can send them to us. And then it's just, emphasizing that we are experts in eye health and not just vision. So what that looks like is, patient comes in for the routine exam. They're going to get, Nerlens questionnaire. And so right off of that, we'll be pulling any kind of symptoms that they might not be thinking at all could be related to something that, so we'll be pulling dry eye, we'll be pulling neck tension, muscle knots, headaches, all of that. So right away, we're already screening them for ways that we can discuss, hey, by the way, did you know that this is something that we can? And then really just standard care, trying to elevate it. All of my patients get, full wide field optometry. And every single one of my patients, I make, an effort to fully explain that picture.
Okay. Say more about that. I think that's an important nuance. When you say fully explain, what is that process? How do you do it? How do your associates do it? How does that look?
Yeah. So how I do it in my exam is, you know, kind of right after I pull the slit lamp away, I go straight kind of to, the testing. So I'll pull Optomap up, and first thing I do is I zoom in extremely close to just that posterior pole, optic nerve and macula. And, I make it quick, make it brief and understandable because patients forget everything. So I point out the optic nerve, and I essentially just joke with them. I say, this is your optic nerve. That's proof you have a brain. Right. Get a quick joke in. And then I point out the macula and I tell them this is where your 20/20 high definition comes for your center vision. And then I make, big point at the vasculature, their arteries, their veins. And, I break down what we're looking for and that we can actually see complications from systemic disease and systemic infection. So, mention blood pressure, diabetes, cholesterol, anemia, and then tell them that there's hundreds of conditions systemically that can show up just right here on these pictures, and that it's the part of the eye that actually catches light and creates vision for them.
I like the way you connected it together. You're okay. Here's your assessment. I'm sure you do other questions too, but you have the neural lens assessment. Then it sounds like you also have the Optomap, and you start putting together a picture. I also like how you connected with them with humor. Like that. That's actually I like that. Like, oh, it proved you have a brain. I was like, you know what? That's a good point. And it made me think about it differently. And I've been in the industry for so long, and I've never thought of it that way. And I was like, I like the way framing, and also imprints in my mind. Oh, I remember that now. And so the patient probably remembers it too. I like the way you frame that.
Yeah, and I find that as far as patient education goes, you just need to be simple and you need to get them engaged. Hence,
Yeah.
actually paying attention, because otherwise they're just thinking about their shopping list, what they're going to do, leaving the exam, and if you want their attention, but you also want to educate them different things that you're capable of doing.
How else are you engaging them? Like, what are some other things that you do that get their attention? You that you're not just you, but your associates, your team, like almost like not just it's not just about Darian, it's about the entire team doing the same way and engaging in the same way. Like, how do you do that?
Oh, I'd say, there's little quick bits of humor across the team engagement as well. Team will, explain the tests. And really, we we just talk to our patients, and I mean, like, not just about vision and what they're coming in. When I walk in the room, every single time, my first question is, "What's exciting in you?" Forget why you're here. We'll get to that, but that's my first question every time. I want to actually engage and connect with them.
Nice. I like that a lot. That's actually a great. Yeah, I think I've heard that before. It's like, hey, engage with the person before the task. So you've grown it, multiple associates, multiple folks working for you. What was the thing that happened that you didn't expect as you were growing practice?
I'd say, one of the things I didn't expect is just kind of some of the relationships with staff, and, really as engaging with them, just actually really caring about them and growing the team, and not making it, solely about what I can do or what we can do for, on the doctor and clinic side. But we try to have fun. We, you know, shut the office down for an afternoon every quarter, and we just go do something together. So the last one, we went and we just had a pottery class together. A lot of fun. And we've gone and we've had margaritas together. We've done bowling. We've done several things just as a staff.
Nice. That's pretty cool. I like that. So it's almost like you didn't expect to have such a close relationship with your staff. So it sounds like. Um, why grow, right? You could easily just be yourself and, a couple of small staff. Why expand it?
Um, I just really enjoy giving patients something new.
Hmm.
And giving them better care where I don't have to, necessarily refer them out for something that just because I don't have a test in the office, or just because I'm unsure of risk levels of, does this need treated? Does it, not, can we improve it before it would need, treated or injections or surgery? I'd say that's a big part of the fuel. Another big part of the fuel on maybe a slightly more negative emotion side would be really not wanting to feel like a commodity and being bossed around by patients, essentially.
Yeah, I can definitely understand that. You're right. It's like, hey, um, I have stories. Actually, some really interesting stories as well as folks listening.
Oh yeah, I've had, I guess I can tell a story here. I had like 2 patients within my first 2 months graduating, 1 to 2 months, where they really just, didn't know what I can do, and they were coming in for what they thought was an easy, quick, perceived fix on their part. So one patient was advanced macular degeneration, full macular scar on one eye, and so just central blindness, and then an active C and V starting on the other eye, and very shaky vision where it needed treated. But what they thought they were coming in for was to get contact lenses, both eyes, and it was going to fix the whole problem. And their corneas weren't, healthy enough for it. And then there's, the monocular concerns of, I'm not going to do something that can cause an infection on, your good seeing eye and make you go blind. And me and that patient had a full heated argument over what was best for them.
Oh, wow.
And then, another patient I had, which is a little bit humorous, but I keep this as fuel a little bit. It wasn't actually the patient, it was the patient's mother, because the patient was a teenager. They were coming in routine, healthy preventative exam. They happened to wear contacts too, and we were going over options. And for whatever reason, maybe it was just, me not seeming confident from being a new doctor, the mother just started laying into me on, very pointed questions of, where did you graduate in the class? What was your GPA? What did you score on boards? This and this and this. And like very pointed, and arguing over, we don't need to go over options. This is exactly what they're getting. This is the numbers in the prescription they're getting. And this is how it's going to be. You're going to write the prescription. We don't need to put a trial on. You don't need to see anything about this, which, I kind of keep all as fuel. I really hated that experience.
That's a wow. She was like, you're going to give my son this prescription. And that's it.
Yeah, exactly.
Wow.
And this is how you're going to give the prescription.
Well, it sounds like you've kind of used that and morphed into the process that you're doing now with how to connect with the patient, build that trust, and how to actually become that trusted source. So that's actually pretty cool how you kind of turn those around and really refine your practice based off of that.
Yeah, absolutely. It's really 2 of the stories that are just been my fuel to be like, let's do more. And then
I'm just curious, are they still patients of yours, those 2?
One of them never came back.
Oh, fair enough. I could see that. So now a lot of folks are having challenges around staffing. How are you dealing with staffing challenges? If you are, and if you're not dealing with staffing challenges, what's your secret?
Well, culture is a big one. I mean, we've gone through a few, staffing turnovers. Some of it seemed to come down to a common denominator that was causing some morale issues, and we're moved past that. And I really put a lot of the selection ability into my staff. Because, if my current staff wants to say no to a candidate, in my mind, why bring them on? If they're saying no that early, we don't need to move forward either. And so I have, whenever I'm hiring someone, I actually have one of my staff members filtering through a lot of the applications, and she's a little strict, a lot, which is great. So to weed out anything that we might not think is our culture. And then we do some personality assessments, not necessarily for hiring, but for direction on how we approach training and correction. And then we do some general skills-based testing as part of our hiring process, mostly just to add almost a little bit of a hoop or inconvenience to see who actually is interested in the job, and then it just click a button. Who's willing to click one more button to be like, yeah, I want that one.
Yeah.
But I put a lot of trust in my team on figuring out, what we need in culture and what's a good match.
I like that. And curious, what personality test do you use?
Working Genius.
Okay, yeah, that's a good one. Yeah, I like that one too. What was the? It tells you basically like your like what you like to do and what you're really good at and what you may struggle with. That's a really good one.
Yeah, essentially what lights your fire and what drains you.
Yeah,
Yeah.
yeah, that's a big one. It's great with helping communicate with each other too.
So, yeah, absolutely.
So reimbursements is another area people are having challenges with right now in the industry. How are you dealing with flat to decreasing reimbursements?
We honestly we have like decreasing reimbursements. We haven't had as many as some people on like the downcoding side, which is a little bit surprising. But as far as how we're dealing it, we're exploring options. We have enough, technology that we're not noticing, any pain points on that side right now. On the medical care side. So we have contrast testing, we have ERG, visual field, OCT, and we know how to. We've implemented them all extremely well. So I would say that that's not really something that is very noticeable right now. And then we're, starting to implement some more cash pay things. So, Neuralens would be a cash pay. IPL, we're exploring kind of entering into some of the aesthetics side as part of our dry eye clinic as well. So probably mostly that, emphasis on some more of the, cash pay out of network, procedures too.
We hear that a lot more too, doctors, and in our practices, we're doing something very similar. So, expanding that scope, it's really been good for, I think, everyone in the industry. So what are you most excited about in the future, both with the field and with your practice? What are you looking forward to?
Cool with the field, just expansion of care for things that we're trained in. And, technology coming out, AI is accelerating development of care just really quickly right now. And been watching that really closely at, what machines look like they're, doing pretty good. Maybe they're lagging behind where we want them to be in a few years. So we're watching it really closely, and we might pull the trigger on a few different things in the future. For the practice, I have to say, my sister's graduating next year, so working with her is a big excitement, and she's bringing a fire on as well. So I've started like a little myopia management side of the practice, and I just don't have room on my schedule to heavily lean into bringing in entire thick demographic on. I'll see children, but I just don't have room to see most of the children. And she's interested not just in the myopia management, but also in some of the pediatric side, which is going to be a huge benefit for our area, because there's just not many pediatric eye care specialists at all.
And where are you located again? Sorry, I don't think I mentioned that.
Pigeon Forge.
Pigeon Forge, Tennessee. Yeah.
Mhm.
And you're Dollywood.
Yeah, so excited about that, and then excited about SLT in the future as well. Just bringing that on to help some of our glaucoma patients that there's just not a lot of nearby offices that even offer it, and sometimes they just don't want to do it either.
Yeah. Well, it'll be interesting to see how the dynamics work with your family members, sister coming into the practice too. Maybe we should have you back on again after a couple of years. Very good. Yeah. So let's shift gears a little bit. I'm curious. I'd like to hear a story about what makes you you, Darion. Like it could have been a story that was when you were younger or older, but something that was really formative to you that made you who you are today.
Moving around quite a bit as a child, where strong emphasis on being able to just be adaptable, and lean on family as well. So I would say that would be, a big portion. And then, past that, just my wife and family. I mean, they're my anchor, and I can't do much without support there.
That's awesome. So knowing what you know now, what would you give your younger self right after graduating OD school? What advice would you give your younger self?
I would say be more aggressive as an associate, where I think, right after I graduate, I feel like I could have done more to be active promoting myself and succeeding as an associate. It took me a little bit to build up my own schedule, and I'm very confident now that there are plenty of things that I could have done to do that while I was there. Because there was a lot of opportunity, and I eventually found them. I eventually found those opportunities. So I would have just, told myself to, get in there, dig through the reports, dig through recall lists, really kind of, be active. It just took me a little bit to get going.
I like that. That's some good insight. It's interesting. I always find that's hard to know until you've actually done it. And like, oh yeah, that seems so obvious. But yeah, until you do it though, it's like, okay, it didn't seem this. So if people want to connect with you, Darion, where can they connect with you?
I would say LinkedIn, just my name, and then my email would be Darion Horner OD at Gmail. That's a great place to connect as well.
And we're going to put that in the show notes as well. So if folks can get a hold of you if they're curious, if they need help in their own practices. So thank you again, Dr. Darion Horner, for being a guest on the show.
Thank you.
And I wanted to share a couple of takeaways. I think the two biggest things that I saw a theme that kind of came through was connection, curiosity were the two C's that I saw here. And for folks who can't see, who are not watching the YouTube video, Dr. Horner has, I think, about 34, 35 board games behind you.
Oh, more than that. It's here. We'll do a scan.
Holy smokes. Okay. So you got like over probably like 100 or so up there or more. Oh, wow. It's a whole shell. So maybe a couple hundred, maybe.
Yeah. So a couple hundred. I haven't done it a ton since my family grew, just for time, and I focus a lot on them when I'm home now. But I actually used to review games. And so some of these were, review copies and early promos and things.
Yeah.
But if anyone's interested in that, my Instagram is Tennessee Meeple.
Well, what is it? Tennessee what?
Tennessee Meeple.
Excellent. And so, like I said, one of the themes is connection and curiosity. And I feel like that's kind of what you do with board games, right? So you like to play games, but then you saw that challenge with your patients. You're like, well, how do I actually fix this? How do I, quote unquote, win the game, right? If I'm going to put it in a certain way. And you did it by building connection, which is also what games do too, right? They help build connection with people. And how do you ask the questions to patients? How do you build trust, building humor? I think that's a really interesting approach that you took to building connection with patients. And I like what you said about keep it succinct and short, because you're going to lose their attention. The whole point of the conversation is to keep their attention the whole time. I love that. And do it with humor and asking them questions and getting their input and using their words to do that. And that all started with those two patients who said basically like, basically, I'm putting words in your mouth, but basically saying, hey, you know what you're doing. I'm the expert because I'm the patient. And you're like, well, no, that's not the case. And so in turning that around to now where you're the go-to expert, I think is fantastic. So that's a great lesson and insight for sure. And thank you, audience, for listening as well. And if you learned something or laughed, share the podcast with your friend and make sure you hit the subscribe button so you don't miss an episode. If you use the HubSpot link in the show notes to book a meeting, I'll also send you a free copy of my book, Optometry Redefined. Thank you again, Dr. Horner. This has been another exciting episode of Optometrists Building Empires. See you next time. That's a wrap on another episode of Optometrists Building Empires. Thanks for joining. For show notes and more, visit buildingempires.live. This show is proudly sponsored by My Business Care Team. My Business Care Team was born out of staffing challenges my wife and I faced together, managing multiple optometry locations. We refined our approach at Classic Vision Care and now offer our expertise to others. If you're experiencing challenges with staffing and you'd like to set up a discovery call, we'd be happy to help you and connect you with the right resources. We'll see you next time.